what we're very quickly going to go through is just going to get a bit of a background into everything, just to understand, but understanding the key controls. Once we get to the key controls, everything comes off those controls, and then understanding what coronavirus is. The return to work protocols, what will development response plan and all that kind of stuff, and the review documentation. So I've templates for all that. I've taken the HSA's version and the NSAIs and all the other IBEC and basically made them fairly easy to input. So that's there. I'll give that. We'll give it out to everyone as well. Of all the declaration questionnaires all ready for you to hand out to everyone as well. Induction needs to be done as well. We'll talk you through that, and then just a couple of different things that need to happen in relation to first aid. The appointment of compliance coordinators, compliance officers, workers reps, and the people and what their role is. And then just the workplace itself, okay? And this will depend, I was talking to Suzanne about this last week as well. This all depends on if you own the building or you're renting the building, some of the controls, we'll go through that as we're talking through. And questions, I'll try and leave most of the questions to the end if I can. So a little bit of background. Okay, so what we're looking at here is we're in the middle of start of July. By the time September comes along and you're all back, this could be significantly different. So all we're doing, and I'm not going on the hearsay that we're hearing in the papers and on the news the last day or two on how everything is going to change and that we're all going to be jammed into a classroom together and all that type of stuff. So I'll go on with the information we have now, and then as things change or actually change in the next couple of months, the lads might ask me back to do something again the week or two before you all open up. There's no issue with that. Right. So this is weird, isn't it? All just standing looking at a computer. Suzanne can't get because the ESB is gone and all. So look, it's quite different, and it's a significant challenge for all of us. Right? None more than you in your classroom settings. And with the nature of learners you have, it's definitely going to be a challenge. Okay, so to understand what we're dealing with, okay, the coronavirus, most people are well aware of what it is. So it's an infection that's through your lungs, your airways. It's monitored by the Department of Health, and it's a lot more infectious than a normal flu. Okay, so the symptoms. Okay, these are the key. Right, people need to make sure that your workers that you're working for are working for you, or the people that are coming into your training rooms, they need to understand these symptoms, and basically everything comes off these. Okay, I think most people at this stage know that, but this is the bit that's probably the most confused in relation to how it spreads. Right? So it's not through skin contact; it's through someone coughing, sneezing, or speaking. And if those droplets then land on someone, one sec. If those droplets then land on someone in their eyes, nose, or mouth, then there's an issue. Or if it lands on the surface, and the issue with the surface is we don't know how long it lasts. Right, so we can't tell you how long it lasts on a table, a piece of paper. They have a fair idea, but there's no specific time frame. So it's all about, and this is where it comes back to the controls, the hygiene controls, where we're looking at here. So number one, know your symptoms. Right. Number two, then you're at risk groups, and we'll talk about that towards the end of the presentation, how to handle that, and when we go to the scripted forms. Hand hygiene, huge. Access to running water. So we're becoming a little bit more too reliant on sanitizers. Sanitizers are not as effective as running water and good hand washing. So they're to be used only as a substitute once that's not available. Okay, and the next bit then, cleaning. I'm sure this is probably causing everyone a lot of concern. How often, where am I going to get people to clean? And to be honest, I'm back out to cohort teaching now at the moment for Safe Pass First Aid. Most students, most people are really, really helpful when it comes to this. If you have the equipment there, they're doing it for us, and the procedures are there. So again, we'll talk you through that when we get to the classroom section at the end. Physical and social distancing. Right, so obviously there's huge debates about all this, what it's going to be and how it's going to change in September. You're probably quite lucky that Simon Harris is the new minister for looking after your section, because he will have a significant input into it, so you will hear probably first. Coughing etiquette, respiratory etiquette, so making sure people are coughing and doing that correctly, and then washing their hands afterwards. So that's the bit, like, everyone's coughing correctly, but and have the good respiratory exercise. But what they're forgetting is quite simple. They're not washing their hands afterwards. Right? So just will have to educate your students and your staff on that. So the key controls, right? We need to make sure that we have everyone engaged, right? So you're going to have workers, you're going to have people who are back in, who are going to be really, really uptight, and learners, and and rightly so. So you need to be able to talk to them about that and get that message across. Communication all the way through, how things are changing, what we're doing, and then your training. So you're going to have to do induction training for your staff, but also induction training for your learners. You're going to have to get your learners to understand what the new controls are. Right. So the way we used to do things isn't going to be the way it is. It's quite simple, right? Okay. We need to be very, look, as a tutor, I know I got so many looks walking into work with the first aid stuff. I now have all broken body parts from shops, but after borrowing, and we just have to get different things to come away and do different, and come up with different ways of teaching, and getting the message across in a way that people understand as well. When we get back, a couple of other things we're going to be, it's between yourself and your workers. So you're going to have to do some form of training. Online training is good in relation to, you might get some information out to your staff before they come back, but when they go back to the workplace, you're going to have to walk them through everything that needs to be done. Information and guidance, the development of the response plan. I'm going to show you the response plan in a minute. And then we have to appoint people for certain roles within COVID-19. So you have to give someone the job of being the cleaner, but looking after the cleaning and making sure the cleaning is done and inspecting it. Someone's responsible for the compliance officer, someone's responsible for the isolation room, someone's responsible for getting the new first aid equipment, and those things. But again, that's in the response plan that we'll have, and then the induction training, okay, we can give you. All right, so going back to, I'll just see if I go, well, there was a couple of questions there just before we move to the next section. It's just you putting in stuff, is it? Right.
And that's us, Shane, just reminding people how nice you are and giving us templates and bits and pieces like that.
Right, you shout, Barry, if someone needs a question, will you? So then I don't be stopping, because it's distracted enough when sub there in the corner.
No, don't you worry about that, Shane. We look after that part. Although I'm sure that, I'm surprised that hasn't been a question, but you carrying body parts in and around the place.
You know me too well. That's the problem. Right, so we'll the return to actually get into actually what you're going to have to do when you go back. Right. Okay. So first thing you're going to have to do is review and then develop some documents. Okay. You're going to have to, but and develop is a bit nice here, because I'm basically giving you the templates. Right. So self-declaration and the questionnaires, I have them for you. We'll go through what needs to be done and how often. You're going to have to do some training or do induction. You're going to have to, if you some of your first aiders, there isn't an update on the course, but you just need to understand there's a couple of changes, and I'll go through them in a minute. And then we have to, so you might have heard of compliance officers for construction, workers reps, coordinators. Everyone calls them a little bit different. So the word I normally use is compliance coordinator, because you're just helping to make sure everything is in place. And then you can have workers, you're going to have workers reps. So you're going to have a team of people looking after this for you. Yeah. And that's the key. Like that, just on the last one here, we've got to make sure it's a team of people. It's not one person's job when it goes down your workplace. It's far too much in this to be leaving it to one person. Okay, and it's stressful enough as well to be just left to one person to get it all done. So first things first, right? You need to inform your insurance you're going back, right, and how you're going back. Right, okay. If you've got people working from home, as you can see, you can see everyone's lovely kitchens in the background, and my office at home here. So that's a huge part of this. Right? If you haven't informed your insurance that we are doing all that, they're just going to wiggle their way out. You've got to have a conversation with them about that, right? And you've got to tell them that when you're going back, and what additional controls you've put in place. And some insurance, depending on who you're insured with, they may not. So as well. So your safety statement and risk assessments, so they have to be updated. So under Section 8 of the Act, this is more than a significant change. So you will have to update every single one of your risk assessments. You'll have to update your safety statement, and you will have to retrain your staff on the safety statement before going back to work. Right. Now, there is a tool, besmart.ie, that the HSA have. It's there for free. Okay, you can use that. and it has everything. It has a lot of stuff in it for yourselves. So and it has a lot of templates and I have a template risk assessment done for Southwest Wexford here, and I'll show you that I've just done this week. You might have standard operating procedure for some of the stuff. I'm also a QQI provider. I'm like yourselves. I might try and get some funding off you as well for the re-engagement. So yeah. So look, the standard operating procedures around that and how we're going to manage external authenticators, how you're going to manage the paperwork, all that type of stuff. So that'll need to be relooked at as well for yourselves, and then your response plan. Right. Okay. So right. So I'm going to go through all this the paperwork that you're going to have, and then I'm going to show you everything. Okay. So then you have your screening form. So if some of you have been unfortunate enough to have children doing the GEA, you'll know that they'll be filling this in every single training session. Right? Okay, we won't be doing that. Right? We won't be torturing you to have to fill in paper or doing it online or any kind of stuff. So you fill this in once. At minimum, the requirement that has to be done is 3 days before people return to work. Okay, it can be done 2 months before they return to work, but once it's done 3 days before they return to work, that's all that's required. Visitor and contact questionnaire. This is something you won't see in the HSA response plans or any kind of stuff. But there's no point in you screening all your staff, and then I come in as a tutor for your specialized courses like your safety or first aid or stuff like that, and you haven't screened me, or you have electricians coming into the building doing work for you and he's not screened, or a plumber. So all those. I would be, and to be honest, I'd be screening your students as well, too. So because before they come back as well, because you're all in the adult section, so or teenage, so they are carriers of it. Okay, so it's not like a primary school. All right, close contact tracing forms. The good news for that is that most of you have that done anyway. And obviously we've got the app now, but most of you have that done because you've trained. You all have to keep attendance sheets for everything, and so you know who's in and where as well. So that'll be done, and then checklists. Now there's loads of checklists on the HSA website on the BSmart section. Make a checklist to suit you, because if you go for the checklist there, you'll have a headache looking at everything. So wait 1 sec. I'm just going to get the other ones. Response plan. Where is my response plan? Don't have it up.
Shane, just while you're doing that, what I'm just going to mention is that the templates, a lot of the templates that Shane is talking about, they are available, and when we send out an email later on today, those templates will be attached to it. We'll also send out a few other notes from the bits and pieces that Suzanne mentioned earlier on that some of you may not have been able to hear. So just to let everyone know that will be happening. And Shane, back to yourself.
No, you're all right, Grant. Thanks for doing that. So this is your response plan, standard operating procedure, whichever way you want to call it. So feel free to change this as much as you want. This is a template for you. So what you have is the purpose, scope, your policy statement. So your policy statement needs to be signed by whoever the director is, the company or the chairperson or that kind of stuff. So are we companies limited by guarantee? Are we limited companies? What's the way on that? CLGs, is it? Bar.
Sorry, Shane, it'd be CLGs mainly, I'd say.
Okay, so it's the chairperson.
I think that is the new way of looking at it.
Yeah, so it's the lead director, as we call it, or the head of that will sign that. Then we have your relevant roles and stuff like that. So so we just click to here, right? So, you've got where you go. So you've got this is again sitting down and organizing, having a chat in your areas and figuring out who's going to do what. So who's going to be in charge of the whole lot, right? Who's going to be the compliance coordinators? Who's going to be the workers reps, right? So something that people forget when it comes to workers reps and it comes to safety, you cannot select a workers rep. They must be elected by the staff first. And if there's no one steps forward, then you can select, right? So to make sure you're in accordance with the legislation, you have to offer that rollout. Then someone nominates themselves, or someone picks themselves, or someone else puts themselves forward, and then there's a vote if there's more than two. Okay, who's going to be in charge of reviewing your safety statements? Who's going to do your workplace inspections? Who's going to be in charge of the cleaning inspections? So that's not in charge of the cleaning. Who's going to make sure the cleaning is done? Right? Who's doing your induction training? Who's in charge of your control measures, your first aid? Now, dealing with suspect cases, if you're not in a building that you actually own and if you're renting one, it'll be their responsibility with you, or they have the duty of care under Section 10 of the Act to cooperate. Okay, so they'll have to make sure that this is done between yourselves. There's a biohazard kit required for that. Okay, it's about 20-30 euro, and then there's an isolation, a couple of bits of isolation equipment they need as well, so like masks and all that type of stuff. Okay, that area in that room, I got excuse me. So the area of the room that must be ventilated as well. So yesterday I was asked by a company, and they were going to put them basically in a box with no windows, no door, or with the door obviously, but no airflow. That can't be the case with the isolation room, right? So there, and it's very straightforward. Your response plan, right? You've got everything in it then in relation to what documentation you have to check, who's responsible for what, and we'll be going through these roles in a minute anyway. Okay, then the controls, and then you can make these more specific for yourselves. Okay, the stuff is there, and stuff like cloakrooms, locker rooms may not be applicable to some of you, and then how to deal with all the cases, and then you've all the screening forms, checklists, and all that type of stuff. So the work lesson checklist, I haven't given you one because that needs to be specific to your area. Okay, I need to see your area to actually give you one of those. Same with the cleaning checklist. Now there is a template from the HSA and all the other forms. Then I have right. So I'm gonna stop sharing that and I go get the other ones. Right, give me 2 seconds. As much as I do this, you don't get used to doing it properly. Where is the employee screening form? There we go. All right. So employee screening form. So you have your screening forms here, right? So you basically, this is filled in once, right? And then 3 days beforehand. I think everyone's familiar enough with the questions now at this stage. How are you feeling health-wise? Obviously, this one here about being outside the island of Ireland at 14, that may change, right? Depending on what we get. I know we have ministers in trouble at the weekend for not doing that, but that's a huge bit. And again, this is personal responsibility, like, and that this goes for your students as well. The fever, all this kind of stuff, all the things in relation to the symptoms, just around temperature testing. All right, okay, you can temperature test if you want. Okay, it's advice, it's not mandatory. If you are temperature testing, do not record the temperature, because it becomes a GDPR issue then, because you're holding medical information. What you do is you can just take the temperature and say all you have to write down is okay. So that means the temperature is okay, and if there was a problem, you just write down that it was over 38 and send them home. Right, that's the advice. Okay. You can get another ones that you're checking here, but there's so I won't go get it because I'll be gone off screen for too long. Basically, you can get ones that come to the side of the forehead, so you're not directly in front of people as well. So there's loads of different ones. If they're any price below 80 quid, guys, don't buy them because they won't work. Right, they won't last. The stuff there is loads of cheaper versions out there, but they're just not lasting. Okay, so. And it doesn't need to be the medical one, which is 190 either. You can just get a standard one as well. So it's up to yourselves as an organisation what you want to do on that. Have you been told to self-isolate? And then is anyone in the at-risk groups? Okay, right. And then they just get to fill in a comment down here that they have, spelling is brutal, asthma or whatever it is, and that's it. Okay, they do not need to sign it. I have the sign in here if you want, because and then a couple more questions in relation to close contact and that type of stuff. You can do this over the phone. Right, if you want with someone, or they can do it online and they can put a digital signature in it. So it's not, don't worry about signatures or any of that kind of stuff. But what you would want to do is someone in the office has to either approve it, postpone it, or deny him and give them a reason. Okay, so if someone comes to you with a medical reason or some issue, you might need to just postpone it and ask them to go back to their doctor to get guidance or that type of stuff. Would be the norm. Right, so that's that one. Right, so we can see the visitor one then. Right, basically nearly the same. You know, absolutely on it. So there's no difference. Other than that, it's just it's the different details up here. Right, okay. And there's a small additional question in relation: are they completing the contact tracing form? Right, that's all. Just to find out. Because if they're not, we're a little bit concerned, right? Okay, because if they're not filling in a tracing form and they're going in and out of different buildings all the time, it's an issue. Now the postman, the DVD delivery guy, the guys delivering in your stationery, they don't need to fill this in. They're just basically popping it at the door and running. Right. So it's someone who's going to be in the building for a significant amount of time. Right. And the last one, then, just your risk assessments. Sorry, Darren, you can tell the lads so extra after using this. I forgot the logo was on it when I checked it this morning. Right, seeing Darren on the call there. So look, this is just a template, right? Okay, Barry, if you're sending it out, will you take out the lads' names, will you? For me, please. Right.
Yeah, no problem at all.
Right. So basically, it's just a template. Okay, so it's simple. Like the risk assessment formats have changed. For anyone who has their safety statements, your safety statement should look something similar to this. Basically, you identify the activity, so possible people getting infected, what's the hazard, the spread of COVID-19, and who's at risk. Okay, you then have basically you do it off a scale here. Okay, and
Shane,
then,
sorry for interrupting you, Shane. Just the slides don't seem to be changing.
Oh, great. Okay. Hold on 1 sec.
Apologies about that.
No, yeah, that's good. Right. Now
also, while you're doing that, I'm going to make it even more difficult for you because I think it's too easy for you. Just a question: if you had learners coming in once a week, what they call, would they have to fill out the forms each week, or what way would that not?
No, once. And what your tutor would do is that, like, so let's say, for example, what I'm doing with first aid or safe pass or that type of stuff, or particularly first aid, I'd ask them at the start of every session, okay, and I'd have my list. Then I have my list of questions as part of it up at the top of the room, and then we ask them, and then anyone who has any changes, we remove them from the room. It's hard. To be honest, at the moment, it hasn't been a major issue. It's going to be fun when it comes to September, October, when we're all sniffling and coughing because of the flu. That's the challenge for you. Really, it is, like, for the 70 odd people are on the call here. That's a huge challenge for you. Like, right, can everyone see it now?
Yep. No, that's great, Shane. Thank you.
Right, okay. Okay. All right. So so you have we go back possible infection, your spread of your COVID-19, who's at risk, and then you have a color coded section, right? So the numbers 5 and 3. So basically, severity is basically it's causing death. Okay, the likelihood here is that I would say it's medium. That's what was my guess on this. Okay, and then you came up with a score of 15. All right. So basically, what you're trying to do is come back up here. So we're trying to get if I'm in red or orange, I'm trying to move it down to green. That's the ideal. Right? Some of the things won't get yellow. So it's a traffic light system. Okay. So when we look at this really quickly, what we're trying to do is trying to get as much as we can, everything down to green. Okay. And there'll be certain things that won't. Right. Okay. Right. Because in relation to the symptoms here, it's very hard to get down to green because it depends. There's always going to be someone who's going to turn up and may turn up with symptoms, and we won't be able to control that. So that's a template. You can use this, absolutely no problem at all. You can adapt that with it all the way down. I just want to go to the very. So it even has the traveling to and from work, and then what we have is we've got the sign off near the end. Okay, all right. But that'll be something you'll need to go through a little bit more in your workplaces. Right. Okay, we'll get the presentation now. Where's that gone? Okay.
while you're doing that, Shane, I'm just going to answer I'm going to answer a few questions, hopefully.
Go on. They're all very quiet. It's very worrying.
No, as I would expect, there's a lot of information, Shane, and to be honest with you, it's great because it's really good. Because, and just to answer sort of Anna's question there, who was actually hosting last week, Anna, what do you call it? Hopefully, first of all, you can see the slides, and then the second thing is, I was just going to say, is all the slides again are going to be available at the end, so that we'll have it. Plus, special edition video will be made of Shane for a keepsake, and that'll be on our YouTube site as well. I just removed my tones out of it though. So so thanks again to Shane for that there. Okay, Shane, I'll let you back at it.
Current slide. Right, so we're set your documentation all, so that'll be there. The guys will send that all out. The only thing here on the close contact one. Okay, all right. So at contact tracing, we also have the app that we got. I think you've seen this morning. 1 million people have downloaded so far. So for us, we have a responsibility when we go to work. We have to have some form of tracing. So I need to know who's been in the room. Okay, so your attendance sheets really are important, and who's your tutor. Okay, and who have your staff interacted with. Under 2 meters, which we shouldn't have happen, and then if they've been in a room for more than 2 hours. Okay, so what's happening in different industries, and every industry is different with this. Okay, other industries are doing one individual form per employee. For ye, I don't see that as a necessary thing for ye, because you're going to have your attendance sheets. You're going to have if you have a tutor, you're going to know who's taking what class. So you actually have your contact tracing done within that. Okay, but if you want it, it's up to your own organization. You can do one for every individual person. It would just create a lot of paperwork. Okay, so your responsibility is only your staff for contact tracing. You just then need to keep a attendance sheet for whoever's who's attended the course. Okay, staff have to keep their own contact. But again, you all have that. There's loads. The checklist we've gone through. So I don't know if anyone has any questions of that. We'll take them if you want at the end, or you can take them now. It's up to yourselves. All right. So what you must do is everyone must do some form of training. Okay. Now we're doing time wise. So they then, as part of that training must be done at 2 meters apart at the moment. Okay. Ideally, hold them in open areas. Like the induction training can be a walkabout. It can be done online, and it can be lots of different ways of doing that. Okay. In relation to the first aid, as we said, this doesn't go through skin. Right? It's not. It's when we touch our eyes or nose or mouth is the issue. So when we go to be a first aid, we do a first aid. We're going to have to get close to someone. Okay. We need to then do a dynamic risk assessment on the person at that time. But what we need to make sure is that we have either wipes in our first aid kit, or we have some kind of sanitizer, or we can wash our hands before we go treat and put on the gloves. Right. At most times we only have one. You may need a second one for CPR and that type of stuff, but trying to limit it to only one person if you can. And you're going to need disposable gloves, face mask, plastic aprons, and enclosed goggles. That's what for your teaching, for doing your first aid. Okay, so they're the key controls. In relation to, is there any changes for first aid? The only change for first aid is that you're going to do CPR with chest compressions only. There is no mouth to mouth. Everything else is the exact same. Right? Okay, AD, use the AD as quickly as you can. All right, so that's the only thing different with first aid. There isn't any need for any additional training or any that kind of stuff. Everything stays the same. There isn't any. If your first aid is out of date, you got to go to a classroom now and go and get it done. Right, okay. So there isn't any. It's not like Safe Pass where they gave it until the end of July to people with certs that were coming out of date. Okay. So right. So I would suspect that most people on the call would probably get this job when they go back to their workplace, has been given the person in charge of looking after all this and getting things. Right. So first things you have to do is you have to appoint someone. Your main job is to make sure the social distancing is taking place, the hygiene are in place, and you're there to help to reduce the spread. Okay, you have two big duties: is proactive and reactive. So your proactive day-to-day stuff, and hope to God you don't have to do the reactive stuff where someone turns up with symptoms and or someone has got COVID in your workplace, and you then have to follow the HC guidelines on how to get everything else done. All right. So basically, you're making sure the questionnaires are done, you're making sure that the contact tracing is been done, and you're monitoring the 2 meter rules. Okay, and obviously that changes as physical distancing changes as we go through this. Right. You got to make sure there's loads of signage. When you're doing your signage, guys, please make sure it's laminated. If you're taking the signage off, which is free on the HC website, make sure you can't print it in black and white. It must be in mandatory yellow for warning. It's part of our workplace regulations, the 2007 general applications. Signage must be in appropriate colour, so it has to be in the yellow that's on it. No paper. Right, okay, nothing on the walls that can't be cleaned. Any signage or any booklets or anything that you have around, you got to get rid of them if they can't be cleaned. Right, so and that goes with your signage, and you can get, there's lots of it. You need lots of it around the place. Then your hand washing signage in your sinks or over your sinks, so then inform people how to do it correctly as well. So they're the key ones that they're looking for. This is an awkward conversation to have, and I know Barry, we had, and I know Marion is there in Access, and Darren as well. I was talking, look, we've had lots of conversation about personal hygiene with people on courses. Okay, so this is a real tricky situation, but you're going to have to do it, and that goes with staff as well. You have to get, and you do have to maybe insult someone and ask them to watch the video and then go wash their, and you observe them washing their hands afterwards. Okay, so we have a duty of care to provide a safe place to work, and we've got to train people on this. Okay, so if you train people to put on earmuffs, you got to train them how to wash their hands, right? But it doesn't have to be an infection control class. It can be just the 90-second video from the HSE online, which I have it on here as well, a link to it, and you can go and use that. Regular cleaning, then welfare facilities, handrails, door handles, all this type of stuff. This now, if you're in a shared building, okay, you're gonna have to sit down and have a conversation with the people you're sharing the building with. If you're in a rented building and there's other people renting it with you, again, same thing. If you own it, it just becomes a hell of a lot easier. You just put in the controls you feel necessary, and that's it. That's something you're going to have a conversation about. So liquids, so soap and soap is much more effective than sanitizers. And hot water is better than cold, okay, but you do need to have, under the general application regulations, part 1, chapter 1, part 1, section 18, 19 and 20, you're required to have hot water in your facility under the act. Okay, so this has been a massive issue in primary schools, secondary schools over the summer, trying to get them up to speed on this. We have to have hot water. Okay, now cold water does work, but it's not as effective. Okay, report any non-compliance to management and ensure that they're addressed, and then basically be there for anyone who wants to raise concerns. That's your proactive stuff. The end bits of it, making sure that people are, adhering to it. Smoking areas, I'm sure this will be fun for your students, trying to keep them apart outside when they're smoking, when they're trying to get a break every 15 minutes, right? And consider then provision of additional controls then if we need to, and then keep up to date with the HC controls, right? HC guidance. Your reactive stuff, I hope to God knowing you have to do this, okay? Right? So basically your job is when something happens, so inform management if there's confirmed or suspected case, make sure people are aware of what to do, make sure the isolation of someone with the symptoms, an isolation room, a segregation area, somewhere that it can be separated from someone so they can go and make the phone call, right? So they can go, once they're in the place of work and they develop the symptoms, they then need to be able to go and make a phone call to their GP. GP will then talk them through what needs to be done, and then they'll be sent off for tests. But we need an area for that to be done in, okay? And that area then needs to be cleaned, okay? Following protocols then for the individuals then in relation to what they need to do in relation to sent home, contacting GP. And again, this is where you need to train as part of your induction. Tell people where the area is, tell them what they expect, and then tell your students as well as your staff on what needs to be done. And then you're going to have to assist, and this is where the contact tracing comes in, because if that person then is confirmed, the HSE will look to get in contact with everyone, right, on that. Right. Your workplace controls. Okay. Right. So your general. So without being in every one of your areas, and the nature of the size of the group we have here, I think 60 something or nearly 70 when I was looking at there at the start. This is going to be a challenge. Right. Okay. Because you're all probably going to have loads of different questions on these different areas. So this is very, very general. And we can probably talk near the end. We're getting towards near the end now at the stage anyway. So on the different controls. Right. So cross contamination, huge bit. Okay. So the infection routes: eyes, nose, mouth. Okay. We touch our eyes, our nose, and our mouth on average 8 times in a minute. So we got to try and get people to stop that, but then we also got to get people to wash their hands in between every activity. That's quite simple. It's before and starting every task, before and then at the end of every task. So entry, okay. I don't know the size of most of your buildings, so you may have an issue with one-way systems. You may not be able to do it. Staggered entry times, if you may be required. In social distancing, maybe people waiting outside. You might look after reduced numbers, and then you're going to have some form of sanitizing on the way. So basically, every entry and exit point that's going to be used throughout the day needs to have a sanitizing point there. Okay, so there's where your funding will come in for that type of stuff. Okay. Deliveries, okay. I know we probably asked lots of people to bring them up the stairs or put it down the room or deliver the paper, whatever it is, but basically reduce the areas they enter. We can't. We have to reduce that, so they're going to have to drop it at the door and run on. I think most people have got used to getting everything their clothes delivered online. Your man just took the fast way, or DPD driver just drops it and runs it outside the door, rings the doorbell and runs. So we're kind of used to that now. That's this stage, but we need to control that as well. Your tools, equipment, plants. So again, I'm just thinking of all the different groups I've worked with. Like we've your classroom, then you've your soccer equipment, you've your GAA equipment, you've got your orienteering equipment or the kayaks, everything. Like, so there's so many different things, and a lot of these places you'll be going to, you will be, under the jurisdiction of the GAA, the FEI, so they'll have their stuff. But for you in your stuff, if you can, ideally, if the one person stays on it all the time, for you, obviously pens, I'm trying to get your students to bring in pens, but even the simple, like, so even for yourselves, it's simple, that's my control when I go around, that's my pencil case. So everything, there's not anything I want is inside there, markers, rulers, everything. That's all, that's mine. So no matter where I'm teaching, that now comes with me. So a little thing like that, because obviously you're going to have loads of tutors. And look, you need red pens to mark and QQI to keep all the notes on it and to, make sure all that. So the red pens are around assessment time are very, very precious things. So those things we're going to have to manage. Desks and computers need to be cleaned. We'll talk about that when we get to the office. But if we can, we just basically stick to one piece of equipment. Additionally, so operators or people using equipment, depending on what you're doing, we got to look at the touch points. So where are the touch points? How often are people touching it? And then we need to clean it in accordance with what's being used. In relation to the overall building area and the common areas, again, this comes back to if you're renting the building and sharing with someone else. If you're own the building, if you're renting other parts of the building to someone else, like I know some of the centres you will rent them out. You will rent other classrooms as well. So these common areas, these need to be accommodated. So frequently touch points must be cleaned at least twice a day. All right, so you're talking about door handles, all that type of stuff, a minimum twice a day. And then depending on how often people are going through them, so you'll need to up that. Right. So can we leave doors open? Can we get fire doors that are actually clipped in? Right. Okay. So that's that type of stuff. Okay. Can you reduce the amount of times people are going through certain things and touching it? That's what you got to look at. Yeah. Now, this is going to change, okay? But at the moment, the advice is that you shouldn't be sharing lifts. It should be someone only from your same household, and that's the advice on it, okay? So we have 5 seat or 2 people in it. This is if someone's outside your household. That's the current advice. If they have to do it, okay? And because to be realistic, that's what's going to happen. You have students then coming, right? If they're not in the same household, they shouldn't be sharing lifts, and we all know that that's something that happens quite regularly. So again, we need to get that message across, and if they do have to do it, this is the situation they're looking at, okay? And then the touch points need to be cleaned within the vehicle, so before entry and then after the exit. And then we keep the same people. If they are coming, the same people come together, right? So they don't run down the shop all together in a crew, 5 or 6. Again, very, very difficult to control that. Okay, but this is something you're going to have a conversation with, unfortunately, right? And then keep the windows partially open in the vehicle if you're traveling with someone. Okay. Right, so that's the current advice. I would suspect that will change, considering that we're all out on a GA and soccer pitch now, kicking lumps off each other. So I would expect that to change, but it hasn't changed at the moment. Okay, so your hygiene controls, your only PPE controls. So hygiene controls, hand washing. Okay, so the link is there for your video when the presentation goes out. Cleaning regime, so you need to actually identify everything. You need to go in and clean and identify every point that needs to be cleaned. So your toilets will also be a high use area, hallways, classrooms, all that type of stuff. I know money is going to be a huge issue for you, so I know what we've done as a training organisation for all our courses. I bought individual desks for everyone. I have an individual bin for everybody. I have an individual spray for every desk, and I have an individual cloth that they use for that day for everyone. So that's what I've done in relation to my training courses for the past first aid, manual handling, my QQI courses, my level 5, level 6, level 4, level 3 course in health and safety. That's what we've done. The desks are €40 a piece, guys. So look, it's my business, so I didn't mind investing it. It's very, very difficult for you in the organization. I understand I'm working for a long time with your groups. Money is a huge issue, and space obviously then as well. So coughing etiquette and respiratory etiquette, so that signage needs to be around the building and particularly around the classrooms as well. You need to get your tutors to be really vigilant on this and getting your students to make sure they're following it as well. So there your PPE. This is it, right? So
Shane, sorry,
yeah.
Can I just ask? I'm just going to put in maybe a few questions there to you, if that's okay. Just because they're relevant to this sort of section, if that's okay.
Yeah, work away.
So this is from basically it's from a few of the people that are watching. So first of all, hand dryers. Are hand dryers yes, no? Should they be using blue roll? What should be used?
Okay, so the issue with this, right? Okay, we'll go to the HSE, right? And the HSE won't give us an answer on hand dryers or not. So the technicalities of it, if someone washes their hands correctly, right? And then they go to use the hand dryer, there's very little chance of that water spreading and causing a problem. But that's depending on everyone washing their hands correctly. If you're asking me for my professional advice, no hand dryers. Right? It would be my advice in blue roll. Okay, not very good for the environmental. My other section of the company is environmental, so it really does drive me bonkers having to tell you that. But that's so ideally, yeah, absolutely.
Okay, next one then very quickly is from Lucy. The isolation room, does it need to be does it need to be a room? Can it just be an area? What's the sort of guidance?
So it can be an area once it's isolated, but then is there people walking through that area, right? So is it like just a partition, like the blue partitions we put in the classrooms? Is it just just them 4 wrapped around, and then there's loads of space over the person's head? So ideally, Lucy, it would be a room. Okay. What lots of people are doing there, they're because it's just not practical at the moment. They're making the people go back out to their car.
And that actually leads on to the next question from Helen. No, she's not saying how do you send people to the car, but same idea. When people are isolated, should you leave them in the isolation place? Can you leave them there, or should they just be sent home?
They're only in the isolation room until they make the phone call, and once they make the phone call, they're off on their merry way to get the test, right? So they're getting out of yours. So it's basically you've identified a symptom, or they've identified a symptom. They then have an additional screening to go through with the doctor. If they fail that screening, then they're sent to a test. And it's just what we're going to try and do with the isolation room is that we're trying to reduce the amount of contact they have with anyone. So there's a bit of work in it. So if someone, let's say if they're in a room, can we then make sure there's no one in the hallways? Can we make sure that everywhere is free? So it's like the president is coming down the hallway. Everything is, there's a bit of security come beforehand, and you move everyone out of the way, and you just get them straight to the room as quickly as possible without any interaction with anyone else. If that's the case, like, so this is where your masks come in. That person then, when it comes to PPE, then you have to wear a mask. The people that are escorting that person to the room, and the person that has the symptoms have to wear a mask. So disposable masks need to be got for that. Again, you'll need funding for that. Like, these things are not cheap.
Yeah, and then what they call it, and you did answer this, and then you confused me a little bit by showing off with all your different sanitizers. So, do you need a sanitizer per room?
No.
Or how does it work? Now, I know you were saying it was basically per entry and exit, but then you were saying you had entry and exit.
Entry and exit, and then I would encourage my students to have their own sanitizers.
Brilliant. And I'm going. This is the last one, Shane. Before the end, if you could show us again. Now, it doesn't have to be done now. Later on, even it's just that visitor trainee form, because I know some people didn't get to see it.
Yes,
the visitor,
I'll do that.
Yeah,
I'll do it.
And then just the question being with it is, if someone then puts down a yes to, okay, they have symptoms, are we going straight into the isolation room, and then follow procedures?
The visitor
trainee room as such, yeah. Or trainee form, sorry, visitor trainee form. Sorry.
You're turning them you're spinning them around at the door and putting them back out the door.
That's okay.
That's it. So like this was being done really well at the start, where I was in an organisation. Like, say I was coming in, they'd ring me a day before, or they'd ring me that on the way down and ask the question. So if you have a plumber or tutor or whatever, make the phone call over before they come in the building, okay, and get me fill in the form, okay, right. That's there and that. I'm just looking down through, grand.
That's great advice, Shane.
Yeah, there's there's another one here. The tutor attendance sheet can be ticked off. Yes, that's if the tutor has a attendance sheet, can the attendees names be ticked off opposed to learners sign this individually? Absolutely, but you're going to have to get the okay if it's a QQI course, or if it's a FAR course. Like, I can't do that with FAR. I can't do that with Safe Pass. Can't do that with manual handling. But I am reducing the paperwork on other sections. But yeah, like if it's your induction for COVID, absolutely, there's no bother. Yeah. Care doc, Yvonne, for you the ring then, and the HC headline. Right. For that. Being hired as an area room right there. Yeah, so yeah, again, Michael, you're going to have to go back to wherever you're hiring, and they have a responsibility for that, yeah, in relation to the rooms. Okay.
So Shane, just sorry, you're I know you're answering the question. You're very good there. You're answering the question in the chat. For those that are watching the video, if you could mention just the question, and then the answer, that'd be great.
Yeah.
Sorry.
Yeah, you're all grand. You're all right. So if the facility's been, so Michael Kennedy, if the facility's been hired and does not have an area or room for isolation, what do you do? They have, so they're hiring the building to you, so they have a duty of care under the Act to provide a safe place for your rent. So they do need to have that. You need to have a conversation with them about it. Okay, there needs to be something there for it. There has to be some way of doing it. If not, you'll be in trouble, or so what was the next question? If there's no Alice, if there's no hand dryer, no blue paper, what can we do? What can we use? Ooh, you can get units. You can buy units, paper units, that go on the wall, and they're, I think they're 20, 30 euro to buy and put up, and they're just put up there, and then they can be taken down afterwards. So it's there, but you will have to have something for that. Right, I thought you only send them out the door if you can go home walking or in the own car. If they came and attacked, oh yeah, it is. Right, so I thought you could only send them out the door if they can only, or they're walking or in their car. Right? If they came in a taxi or public transport, they need to go to an isolation room. Yeah, absolutely. Yeah. So then with that, you're going, so if that's the case, if you have a lot of students coming in taxis or public transport, you're going to have to include something in your protocol how you're going to get them out of the building to the testing area. Okay. All right, this is the last one I'm going to go, and then I'm going to go back to the, because you're answering some of the questions I'm going to give it in a few minutes. Right, so Mayo Abbey, so hi, just wondering if the person takes yes to the question of living with someone who has been abroad, are you expected to send them home, and should you have a question on the visitor form? Yeah, absolutely. Yeah, actually, that's a good idea on the visitor form. Yeah, put that in. You can. All these forms you can make them to suit yourselves. Right. So basically, if someone has ticked yes, if they're living outside the country, you do have to, and they have someone in their household with you, do have to send them home. They should not be there. But again, this goes back to maybe doing some form of training with someone, and with your groups and your staff online first, and then informing. So this all goes back to the very first couple of slides. This has to be based on strong communication. You have to communicate, develop your policies, procedures, and then we go from there, right? And we make sure that because this stuff then shouldn't happen. And if this stuff does happen, then you're now into discipline procedures. You're now into breach of the act. You're now into in a breach of Section 13 that they haven't followed their employees' duties. So it becomes very, very tricky, right? But you have to inform them of all these controls first, right? Good. Thanks for the questions. It breaks up the monotony of me talking to on the slides, right? So PPE and stuff. Okay, so PPE is where we don't have for workers. Okay, this is for workers at the moment. Is for social distancing. Okay, if we have to do a task that's under 2 meters, we then have to have PPE. Right. Okay. Obviously there will be changes in PPE. Like there isn't any guidance from the Department of Education at the moment for any of our courses. They've asked us to be able to provide masks for everyone. They're not making it mandatory to give them to anyone at the moment, but it'll depend as we go forward. That way, I would think this will change. So if so, and then the other thing too is the time you're spending with someone. So if we can reduce the time that they're in the classrooms, that they're not, they're getting a break, which they will do, I'm sure. They won't last the full 2 hours or 3 hours without taking a break or any of that kind of stuff. But yeah, we're trying to do all that. And then you may need it for jobs in relation to manual handling or that type of stuff. You may need to wear masks and gloves and goggles and aprons depending on the task. So that's again task specific. So that would probably end up being more your contractors doing work in your buildings than anything else. Okay. So we go canteens, offices, cloakroom, drying rooms, depending on where you are. And a lot of the cloakroom, drying rooms, you'll probably end up being in different areas, like maybe outdoor pursuit areas for that type of stuff. Yeah. So this is advice. If you can do it, to bring a packed lunch, your own hot water, your own bottle of water, and your own cutlery. Okay, and to eliminate the pour points and touch points on microwaves and kettles. You can, of course, use the microwave. You can, of course, use the kettle. You can, of course, use the canteen. And you can use cups that are in there once they're going through the dishwasher, once they've been cleaned. But to reduce contact touch points, the best way of doing that in the canteen is to have everyone has their own. Okay, they can leave stuff in the fridge. There's no issue at all. But again, when they come into the canteen, wash their hands before touching anything, and then they will wash their hands after eating as well. Okay, but if possible, pack lunches. We try and get people to avoid going out for to shops and that type of stuff, because again, the more and more people are interacting with, and we get back to September, we basically will have everyone back out and about. So if we can and get our students, now that'll be a challenge, right, to get the students to stay in and all that type. But we just need to manage training the best. Try and get them to do that as best we can, right? So again, you might need to look at the classrooms and everything else we'll talk about in a minute. But at the moment, it's still 2 meters, so you will still have to look at segregating, maybe staggering times. Make sure to wash their hands in and out. Hand cleaning facilities or hand sanitizers. So we should have running water in there, so it should be okay to do that. Ensure seating arrangements where they sit 2 meters apart is done at all times, and then we try and keep the same crew. So basically, we have a classroom one has been on coffee break. They don't mix with classroom 2 or 3 if we can. Okay, if we have 2 or 3 classes going at the same time. That's going to be a huge challenge. It's a massive challenge, right? There's no, and this probably will be your bigger areas outside the classroom. Okay, probably the area of concern. So I expect a lot of questions on that. Toilet facilities, exact same, right? We need to maintain. So you need to restrict the numbers. You need to look at your rooms. You need to look at the toilet facilities. Can we get one? Can we get two? And then if we have areas, you know, like toilet street to one toilet seat, or sorry, toilet sink. The one in the middle needs to be covered over. Okay. If you just put tape over, I've seen lots of places just putting tape over. That means you got to go and clean it, guys. Right. So because it's been left open, it can be exposed. I've seen something in Enniscorthy this week in the Riverside, in the hotel. Did this beautiful big plastic. I'm sure it cost a lot of money, but cover over the sinks and over the toilets and over the urinals. Fantastic idea. Really, really good. It was, and again, all it is then it's a quick spray and sanitizing rather than having to clean the whole area. Make sure we have soap and hand washing pictorials up around as well. Again, make sure the signage is laminated so you can clean it. And then we make sure we have all the touch points identified in the toilet, and then they're cleaned at least twice a day, and then depending on the amount of people you have in, a little bit more than that. Depending on how much you trust your students and trust the people using it, you could leave sanitizing equipment there and ask them to spray and clean the toilet before and after use as well. But a lot of this stuff is going missing. It's being robbed left, right, and centre because it's so expensive now. So again, you'll know your areas better than me on that. Okay. So hand towels as well. Okay. So drying room, cloakrooms, the same principles again. If you have them, okay. The only thing with drying room and cloakrooms is not to leave clothes out or coats touching against each other or any of that type of stuff. If we can. And again, the 2 meter rules will be there as well, okay, for all those areas. And remove ankles need to be there. So your office, same thing, 2 meters apart, okay. They need to be 2 meters apart. Windows need to be slightly opened, and we need to make sure then we've got clean equipment for all the touch points, okay. So as most of you are probably still working, or some of you may be working from home, some of you going in and out. So that still says the advice. Any non-essential personnel, you were all encouraged to work from home. Yeah, there will be times you'll need to go into the office, but as much as we can, we work from home. Offices should be at least 2 meters distance away, and then we need to have maybe have additional supports for that. In relation to the office, your work surfaces. So this, you need to be really careful. We've had lots of IT issues with the cleaning of equipment in offices that don't try not use sprays, try and use your wipes. Now, yes, they are more expensive, but they're not going to do as much damage. So everything, if you are sharing computers, your table needs to be cleaned. If it was me, I would get so I'll just show you, right? So my wireless keyboard, my wireless mouse. Because if I have this all has to be cleaned, right? Okay. So this is quite simple. It's just pick it up, throw it up on the way out of the way. And then I can clean my full desk much easier. Okay. So small little things like they are inexpensive in relation to 25, 30 euro, but if you have 10 desks, it starts to add up very quickly. Right. So this is where your grant money may go at. So again, cleaning all that as much as you can. Sanitizers available on the areas as well too. Again, I would encourage staff to have their own sanitizers at the desks, their own tissues, and then they empty their own bins. Okay, so rather than having other people touching off bins or tissues or any kind of stuff they throw in the bin, you empty your own bin at the end of the day. Okay, so you clean it off. Can we leave doors open rather than having to wipe down the door handles as well? Okay, so again, the entrance areas, is there stairs or rails or any of that type of stuff? They need to be cleaned regularly then as well. Yeah. And then we eliminate the non-essential visitors. Right. So is there a need to have every single student coming into you and asking you a whole lot of questions and having a cup of tea with you? Right. Okay, I know it's an essential part. Sometimes it is, but we need to maintain social distancing there. You can use screens if you want, but to be honest, behaviour is the best way of changing this, not physical barriers. Okay, trying to get people to change their behaviours in relation to it. Again, communicate, tell them what you expect as well. Okay, so classrooms, right? It depends on the size you're in. At the moment, we don't know what they're going to do, so we have to go off that it's going to be 2 meters. Okay. As I said, what we've done personally, what I've done is I've got plastic chairs, so they're easier to clean, right? Rather than the cotton chairs. Now you can get the material chairs that can be cleaned. The cleaning equipment is a little bit more expensive for it, but it can be done. Okay. I've got single desks for everyone. They all bring their own pens, their own pencils. You know, like, so if I can get guys in safe pass and construction doing this, we should be able to get the same for ye as well, like, to be honest. Okay. But again, it's something that you need to keep talking to them through and through. Your tutors, you're going to need to bring their own pencil case, their own markers, okay, because, you know, to change the flip charts and using the interactive whiteboards, all these different things. Now, the interactive whiteboards, obviously the markers you're going to have to keep, but you're going to have to spray, you're going to have to clean, you have something to clean them. If you're doing meetings again need to be, if you can do it like this. I know there's certain things you can't do online. You need to be able to see someone, you need to be able to talk to them, you need to understand their body language a little bit, particularly when it's something serious. Yeah, so let's have that conversation with them on how you're going to organize the meetings. At-risk workers, at-risk students, they need to identify that themselves, and then we need to assess. So do they need to wear masks? Do they need to be there? Can they be facilitated online? Can they be facilitated through Zoom? And have we got clearance from the doctor? Have we advice from the doctors? Because none of us here will be able to manage that. Close working, I don't suspect that to be a major issue. Okay, if you have to do a lot of meetings, there's no harm of you having a face visor and a mask. So if you're doing a lot of meetings with one-to-one with students, or you're doing discipline hearings or whatever it is, yeah. So. But anything that's under 2 meters will require additional PPE, and it must be risk assessed and planned before start. Okay. Right, so we've kind of covered most of this. Right. So the isolation, suspected case, a confirmed case, and again, I would never, whoever put up the question, I would never have thought about someone coming in a taxi or public transport for us. We live in the rural bit, so there's no buses where I am, so I don't think about it too often. I'm looking out at the door or out the window at sheep and cows. So yeah, so brilliant, like, absolutely. So again, this is the thing, we're not all going to get this perfect, and you got to manage that. Advice then for the affected person. So basically what will happen is that you have your isolation areas, you have your isolation kits. You have a procedure to deal with those situations. You have a procedure to deal with suspected, then have a procedure to deal with the confirmed case, and then the advice we give after that. Then, okay, right. So that will all come through the HSE. Unfortunately, I've had this 3 times. I've been contacted because I've come in contact with someone who's been a confirmed case. Who, thank God, all 3 of them have been asymptomatic. So they haven't been infectious, and I haven't got it. But it is, when you're out training and you're doing, I was doing a lot of work at the start of this in hospital settings, doing patient handling and stuff. Yeah, huge, but it works really, really well once we all do our jobs in relation to contact tracing and all that type of stuff. So we will, if we do get a confirmed case, I hope it doesn't happen to anyone. All we do is we basically follow the HSE advice and what they tell us to do when that happens. Okay, and they control it very, very well. The cleaning of the isolation room, you don't have to have a contract cleaner to do it, but I would understand you want to do that, because trying to ask some of your staff to go into that room and clean it afterwards may be a difficult task. You can use the fogging systems that also to help to build the area as well afterwards. So yeah, you might need to just have that costed to get some of the contract cleaner into it. And then your waste management, all these then have to be in isolation bags. The isolation, like so the biohazard bags, they're, I think, 35 cents a bag. Okay, so they're all, it's there anyway, so we can tell you, we can direct you where to go for all that. There's no issue. These are trained, a couple of things, and there's, in fairness to the HSE, there's some really good DVDs and little clips on YouTube on there, so both links are there for you. Where I've got most of my stuff there is the HSE, Health and Safety Authority, CIF did a lot of good stuff on that. my details there. If you take out info guys and put my name in, put in Shane, you get me directly. I mightn't answer too quickly at the moment. We've just had our third child last Wednesday. She's a week old today, so that's why I look so tired. Right. So just give us a shout. There's no problem. And there isn't a charge just to ask me advice. I don't. That's not how I operate. And Barry knows that, and the lads know that from dealing with me before. That's not the case. You can ring the office and get me, and they'll put you through to me. There's no problem at all. If you want anything, if you don't want to ask that questions here in front of everyone, there's no issue at all. All right. So normally, as Barry kind of alluded this earlier on about safety and all that type of stuff. Okay, some of the guys who've done the training have seen this with me already. This is health and safety has normally been historically, us human beings are a huge problem. So for the 18 years of doing this, we're always it's people's behaviors are difficult to change, right? Okay, and we've seen it the weekend as well, you know, the videos, and all we're seeing is the negative stuff that we on social media of people meeting up and in Dublin and in bars and all around. That's the very, very small minority of the community doing that. The majority of people have been excellent on doing this, but the only solution to this is human behavior, right? The only solution to COVID is human behavior. So you really, this word is communication, training, that's where it comes in, and trying to get people to change their behaviors, right? Okay, and particularly adults. We're quite a difficult people to change at this stage. So we need that needs to be done. The reason I presume I was shocked when I said there were 70 odd people coming in on it, on this. It was that popular of a conversation. But this is the thing: safety is now the absolute ultimate to get people back to work and get to back normal. And we need to be there. So it's not as longer as Barry says, a boring topic. I know for a lot of students, I know Darren was a student of mine before, so that's on the call here. Yeah, it's a challenge. This stuff is a challenge to keep people's attention, and there's no other way of saying it. But now it isn't. Right, so we need to get, and we've kind of alluded to this already during all the bureaucracy that comes with this, to sign the paper, signing, do we need to sign this, sign that, wages, all these different. Can we do it in a different way? Can we now use Google Docs? Can we do different things? Look what we're doing here. We've all adapted to be able to have a meeting on Zoom, having 70 out of us, you know, where we can all do it from home, right? So we've all got an ethical and moral responsibility, and the big thing here is that we've got to understand that we're all in it together. Right, go back. Right, we're all in it together. Right, okay. So what you're not seeing at the moment is the amount of people that are recovering from it. You're not seeing all the positive things we've done. That doesn't sell newspapers, or that doesn't get stuff retweeted on Twitter. Right, okay. So Niamh, your CEO, alluded to it earlier on. I highlighted it actually when she was talking. Is that is where everything is being done at the moment, unfortunately. And Leo and Simon, and I'm sure Micheál Martin will get better on it, but he's not great on Twitter at the moment. But like, that's where it all is, you know. And like, you see the tweet like Leo puts up about the weekend. He goes out for dinner and he gets absolutely hammered on it, right? Trying to encourage people, and that's the way it is. So it's only negativity sells in these things. So yeah, absolutely. Blast it out there that you're doing things well, you're doing things really, really well, and it will make a difference. It'll encourage people to come back into your classrooms. Our slogan is always to be sensible. Okay. For all my working career in this, I've always worked with agencies or groups that have limited funds, and be innovative on how we can try and get to where we need to get without costing a fortune. So I do understand that money is an issue, but please understand why we're all doing this, right? Okay, we're all doing this because it's the people who are in your classroom or in your house who have underlying health condition, are in their over 60, and then that are at risk. Okay, still that doesn't mean that the young people 16, 17-year-olds don't get it and don't die from it. That's not the case. We just need to remember why we're doing it. So remember why you're washing your hands as often. Remember why you're staying away from people. Remember why if you walk into a bar and it's not being controlled, you walk back out, right? Because all you're doing is putting everyone else at risk. And look after the vulnerable people within your things. The solution is very, very simple. Right, sorry about the pun. Right, it's solution in your hands. Wash them as often as you can, and get people to keep doing that over and over and over and over again. Right. I'll pop this off, Bar, will I?
Yeah, that'll be great. Shane, I have a few questions there. First of all, I just want to say thanks very much, Shane. Like, honestly, the information there, even an old dog like myself, I've learned quite a lot. So really do appreciate it. Some of the stuff there, I have to say, it was really interesting. And at 10:30 last night, I was doing my GAA for the ladies GAA under sixes in Clontibret and Monaghan. I was doing there. Basically things. So I'm certified now and all for that age group. But I suppose, Shane, just some of the questions that were basically brought up. Una had a good one there. What do you call it, about makeup brushes that I would know absolutely nothing about, I promise. But just about makeup brushes. The tutor would generally bring in sanitized makeup brushes for the group to use as such. Really now, should the students be provided with their own brushes that they can use for the duration of the course?
Oh God, yeah, would be I would think so. Yeah. It's not something I'm good at now. Either, Barry, is makeup.
I suppose that the big thing is it's how are they being sanitized, and
absolutely. That goes that goes all the way back. Go back maybe and have a conversation with your tutor and see because the tutor, I'm trying to debate, we're all trying to debate how to do that. I guarantee your tutor has thought of that and they've come up with a solution for it. Right? Because any good tutor at this stage, they always want to go back to work, always want to get back to normal, and we're coming up with ways to get around it. So it's like me with the mannequins. You borrow something, you get something else. You get a broken arm out of a shop. I was St. Vincent de Paul here, and Wexford gave me huge amounts, because it was quite weird walking around, but we come up with ways to do that. Good.
The one thing I would just say to Una there is there's a possibility, from my own experience, a lot of the hairdressers and barbers are using Barbicide, and that again is something that should be used. So it depends if the brushes are suitable for that, because that would be one thing that they could use. But I'm sure, as you said, the tutor themselves probably has the answer. We're not going to ask you. I have a few questions myself, Shane, regarding how to handle babies and stuff, but we'll leave that for another time. Should we wear masks is one of the questions by Denise. The centre that she has, should we just say they're limited on windows? There mightn't be a lot of windows in the different rooms and stuff like that there. So obviously there's a lack of ventilation there, or natural ventilation. Any suggestions on that question?
Right, so we don't have regular vents. Okay, in the classrooms, should they wear masks? Yeah, and I would be looking at them wearing not the way the face covering. I treat it like a shop or a supermarket, and then I would probably try and look at reducing the time frame that they're in the room then on that. Like, so I would try and keep it to 70 minutes, and then break, 60 minutes break, or, that type of thing, rather than
rather than the prolonged 2 hours or such.
Absolutely. So then this is it, and like again, like I said, Denise, if you want to pop me over a picture of the classrooms by email or whatever else, and there's no issue. Or if you want to have a private chat sometime, there's no problem. The lads can give out my mobile if they want to. It's up to themselves.
That's brilliant. That's brilliant, Shane. Alice there just had a question on basically good value providers of PPE and bits and pieces like that. I think if you all went to, go ahead.
As an agency, if you probably, I know there's loads of people. You're based in Dublin, aren't you?
We're nationwide, Shane.
Oh yeah, but the head office is Dublin, isn't it?
The head office is in Dublin. Don't
leave
out the Monaghan people, Shane. You were told about this before.
You in Dublin. Yeah, you like if you're going together as a group and you can get a group deal, you will get significant discounts. There's loads of people. There's loads of people in that market. It's just a matter. I guarantee someone in the room here will have a contact for that. I'm not going. I don't feel comfortable recommending someone in particular.
That's perfect. That's perfect.
Yeah, absolutely.
Do we need? This is from Yvonne. Do we need to ask at-risk learners to fill out the screening forms or get one guidance from the doctor? We have a large number of older learners who would be 65 plus coming into the night classes.
Yeah, so I would get them. I'd get them to fill in a screening form. Yeah, and then so you have a duty of care to provide a safe place to work to them, or safe environment. Yeah, so a safe environment's not a workplace for them because they're learners. And this is the thing. This is the huge part for all your organisations, that you have a different level of responsibility for the students than you do to your staff. So it's employer-employee responsibility when it comes to your staff. So it's not as high risk in relation to legalities with people coming in. But yeah, I definitely would ask them, and then get some guidance, and I'd ask them then, are they comfortable coming back? That group there, you will look at for older over 65s. You're going to have to look at definitely the physical distancing, the sanitizing, the cleaning, and they may need to be wearing masks as well. Okay, on that. Yeah, depends if it's if it's just chalk and talk, or if it's an actual cooking demonstration. Yeah, cooking demonstration. I think there was someone, you missed the question up there. Someone put it in privately. About cooking consideration for training kitchens and cookery courses, timer cookers. Yeah, they'll have to. Kitchens are no different, and any kitchen demonstrations are no different than any other course. We'll still have to have the physical distance under 2 meters, unless that goes down and changes. Right, okay.
And just on the face visors, Shane, face visors suitable without a mask. I suppose again it depends on the
depends on the activity. It depends on the activity. So all PPE is depending on the task. So if I was just maybe doing a registration morning, okay, people are just coming in, taking the form off me, then moving on, the face visor would be fine. You'd be probably looking at masks if you're doing a little bit more contact or closer, depending on the time. So yeah, absolutely.
And Pamela there from Longford Women's Link, just regarding break time, Shane, should we be breaking every 2 hours, and then for how long, or what in an ideal world, what way would you be looking at it?
I'd be looking at 90. I'd be, is this a 9 to 5 course or an even time course?
I'll be honest, I don't know. Pamela, if you want to come in there, you can ask. But
right, so look, we'll do both, because people that. So I would advise that you would be taking breaks regularly. Yes, I would say 90 minutes would be my advice. Okay, and taking breaks as often as you can. Open the windows, but again, this is like I'd say open windows here, right? When it comes to September and the wind is howling, even now at the moment, you're looking out the window, like, what's like everyone else down in Wexford here. It's it's definitely not sunny. It's not sunny southeast today. So it depends on the room and the environment, a lot of that too. And then, like, you can't have 65-year-old people in the room and you have all the windows open, and and they're all freezing. So it's a lot of this will have to be a common sense approach. It's not like I'm trying to avoid the question in a specific answer. It really has to suit what you're doing. But I would be taking breaks regularly and getting people out and about and moving in the fresh air. Absolutely. And then if it's a nighttime course, can we limit the course to 2.5 hours max? Or 3 hours, or and can we keep the time frame down? Okay, and can we help the people? Can we be able? So let's say because we don't want people coming with a symptom to the classroom. So have we a facility there that can be zoomed? Can they join online? Can that course be recorded and sent out like on YouTube, like what you're doing here? All those different things we need to look at. Yeah, definitely. And there's, again, probably as Niamh says, you're going to need funding for this, and you're going to need help, like, because that costs money.
Yeah, there's actually a really good question there as well, Shane. So basically, if you're working with people with intellectual disabilities, I'm just going to read it out just so for the video end of things. But for basically, if you're working with people with intellectual disabilities, 90% of underlying medical issues. Currently, at the minute, they're being taught to wear surgical masks, but do they need to wear gloves? And then just to follow up, it says sometimes we have to help the students basically making art or getting jumpers on, and the gloves are quite hard to work with.
Okay. The answer is no gloves. Right, gloves are another layer of skin once they're washing. So again, I have a lot of experience. I would be the group health and safety advisor for the community workshop here in Enniscorthy. So we have 400 people there between staff and 200 people with intellectual disability. So we've been open all the way through. So this has been a huge issue for me the last 12 weeks, 14 weeks. So you would wear masks, don't need gloves once they're washing their hands. If they were as a teacher and I was helping them with art or put jumpers on, if you think there's a chance of them coughing or sneezing or not understanding that there are requirements to cover them out, I would advise you would wear either enclosed goggles or a full face visor with the mask then at that stage. Okay. Now you've got a challenge there. Are the people that you're dealing with going to get upset with that? Is that going to make them feel uncomfortable? So again, that's something you need to have a conversation with the staff in that area and try and manage it. But you have to, we'll have to protect the staff there, and it would be full facial visors would be your to stop the cough and sneeze landing into your eyes or nose and mouth, because the people you're dealing with there, they don't understand physical distance and they don't understand coughing etiquette. You know, so that's a really challenging job. Fair play to whoever's doing it at the moment. It is difficult.
Yeah, that's brilliant. I'm just going to open it up to the floor. If there is any other questions, if people would like to, I don't know what's easiest here because we've got quite a big group, but if people would like to either speak up or raise their hands or whatever, I will try and spot you. Or if you just want to write in the chat, you're more than welcome to do that as well. I suppose one of the questions, Shane, I'm going to ask you just while everyone's getting a wee bit of courage there is, is regarding the sports end of things. Surprise, I would ask something like that. But I spent 30 minutes yesterday going through what is, I suppose, the ladies GAA sort of course, the module that they have you to do. I have to say now, it was brilliant, and the amount of different resources is very, very good. But regarding the differences, Shane, with children compared, it's not going to be easy. No, it's not. Regarding differences between children, working with children and working with adults, is there any major big differences, or is it basically follow the guidelines and go that way?
Yeah, there's huge difference. Like, if I'm teaching adults, if I'm coaching adults, as you would know, that my background is I'm a fitness instructor, but I work with Wexford Youths, the elite. I'm working with them at the moment. So the difference here is really simple. As I'm working with the men at the moment, is adults. It's not what we were told in March. Children are not as the infectious ones. So we allow them to do what they need to do. But if we're teaching with kids as if 14, 15, 16 years of age, they're going to have the physical distancing when we're talking and we're doing our meetings and all that type of stuff. But there is significant differences between all the sporting agencies. Like you were talking about the ladies Gaelic football, maybe do a half an hour. The FAI don't have anything like that. Right? They don't we don't even have to fill in screening forms. Like for the lads, we do have to for the elite level, for the National League, for the likes of the professional players. Yes, there is screening forms, but not for the underage players. So in all the clubs I've been, we've done that. Again, the big thing is sanitizing the equipment, So really simple solution is a knapsack sprayer. Right, knapsack sprayer full of disinfectant. Spray the cones, the footballs, the goalposts, the flags. Even if you have playgrounds, guys, that's a real simple way of doing it. It's just a knapsack sprayer, and clean the playground and the equipment you have, and it won't damage the timber. Just don't use bleach. Right. But yeah, that's these type of things. The sport and other you've got to follow the guidance on from all the organisations, but you got to do what's going to make your members feel comfortable as well too. So there's a huge difference between the GAA, the soccer, and obviously we haven't got the rugby back yet, but they'll have a difference of opinion on it as well. And none of them are right, none of them are wrong. It's a mixture of everything you're going to use. That's what you're going to do. I have a question coming in privately there. So just wondering if our training rooms, our training kitchens are split into pods. Do we still have to have time controls? No, that wouldn't be. No, you could. But again, the limited amount of time someone's in an enclosed space, that's what we're trying to do there. Okay. And Pamela, full day far. What do we mean there? for that. I wonder. Do you see that question there?
Sorry, yeah, that was Pamela when we were talking about the 2 hours. It was just it was a full day.
Yeah, great. Okay. No, we're some of us are shy. We don't want to ask anything. Don't want to pop in.
Shane, they're just really looking forward to this video coming out. Hopefully the cinemas will open up by then. It's the usual. No, what they call it. I just want to say to everybody, for myself, desk screens.
Oh, yeah.
Sorry, I thought we'd mentioned desk screens. Apologies, Mary. So just regarding desk screens, Shane, and the use of them.
What do we mean by desk screens? Are we talking about like this, the perspex between the desks? I presume. Is that it? Yes, no, Mary?
I'm presuming the same.
I just want to I don't want to answer a question, but it's not what is that what Mary?
Yes, Shane.
Yeah.
Can you hear me?
Yeah, I can hear you. Yeah, grand.
Yes. Like I wouldn't be able to put individual desks into the space, so yes. I have long tables. So my idea is to use desk screens.
Yes. Okay.
Now,
when you're using desk screens, just make sure you're getting a fairly substantial perspex. Make sure the perspex is not going to fall on someone. Right? So you generate you've maybe reduce one hazard, but then create another one. So I see, and they didn't need to be cleaned. Like if any of us go into shops now at the moment, they're absolutely manky dirty. Like,
I know.
So they need to be cleaned, and they need to look clean as well too. Like there's some of them they say they're sanitized, and there's
right.
smear.
So, and what's the alternative? What you were talking about, individual desks.
So you can individual desks are just little. Basically, they're one. When you're doing your leaving cert, little desk you see in the halls.
But they have to be then 2 meters from the next.
Like even if you put a screen, if you put the perspex screen up, right, they still have to be 2 meters apart. They can't be.
I know.
They can't be a meter apart, like.
Yeah, and the other bit then is what about like I run a homework club as well. Mm-hmm. So what about tutors touching like documents, copies, and books?
Walk away. Once they don't touch their eyes, their nose, or the mouth, they're fine. And once they're sanitizing, so between each, let's say they're going from student A to student B, so sanitizing between each one.
Right. Okay.
Okay. There's hardly a sink in the room, is there, Mary?
There's not in the activity room, no, but there's
Yeah. So like if there was, it'd be great, but don't worry about that. So again, leave it down, and then the students that they have, just the kids, just make sure they are encouraged to bring their own sanitizing equipment as well, and then encourage them to wash their hands before they start.
That's very slim.
Pardon?
The chances of that are very slim.
I know that. You have to try.
Okay.
Grant, has anything else?
Thanks, Shane. Yeah.
No problem.
That's great, Mary. And just Shane, Helen Flanagan has a question. Just I suppose, just to confirm, if you're renting a space in a centre, do they have to have an isolation room?
So does the centre have to have an isolation room, or does the group? So it's again the people that are having the centre should have an isolation room for this. They have a duty of care under the Act to ensure that there's a safe place for the people that they're providing the space to. So the answer, the centre should have one, but yeah, if not, then you need to have some control yourselves. Definitely, you need to go back to that centre they're renting and have that conversation.
Well, Shane, that's absolutely brilliant. We leave the questions there for today, unless you have a wee private one there and I didn't see.
No, I have 2 private ones here. Yeah.
Okay,
so if you don't have someone on reception controlling the entrance, is that a problem? Bree, do you mind coming in on the voice on the call just to ask that question? Because that one I'd like to get into a little bit more.
So what I'm just wondering is, like, if you have a centre whereby you like normally we would have just people signing in as they come into the centre, but there wouldn't necessarily be somebody to greet them at the entrance, and then they just go to their classroom.
Okay.
So I suppose what I'm wondering is, like, if you don't have somebody on the entrance who's ensuring that people are cleaning their hands, like, I understand that what we're trying to communicate to people is personal responsibility for those things, but I suppose, is it an issue if you, like, should we be encouraging tutors to monitor their classes coming in?
So I would, so like the people, so are you in your own building? Free?
Yeah.
Okay, so my advice to you there is the first day or two you're back is that you would have someone out there, okay, right? And then intermittently after that, then supervise it, okay? If you can, if that's possible. But again, you've hit the nail on the head about personal responsibility. It's the people coming into the building that are using your facility have a responsibility to sanitize and clean. You can only encourage them to do that, okay? It's not a problem if someone's not on reception. The only issue I'd have there is then how are you going to control visitors, or how are you going to control people just walking in off the street?
Well, I guess it has to be through a sign outside the door or something. I guess, I don't know. And can I ask one other question, Shane? In terms of the COVID compliance officer that you're supposed to have, that person doesn't have to be on site at all times when is open. No,
definitely no. And hope that help. No water.
Yeah, thank you.
And then I have another one privately then, Barry, just before we get to does the Perspex dividers between the students not eliminate the need for 2 meter rule? Nope, definitely not. Okay, they're an additional control, they're an additional barrier, but you must have 2 meters apart. That's at the moment, guys, to be honest, because that may change significantly by the time it comes to September. All right. But at the moment, doesn't matter what dividers, what you have, if they can't social distance or physical distance for 2 meters, they are not to be in that facility.
Hi, Shane.
How's it going?
This is Mary from
How are you, Mary? How are you?
And Dagmar. Congratulations.
Thanks a million.
Was it a boy or a child?
The girl, a baby girl, another baby girl.
Good, congratulations. Shane, you know our building in Westgate. I just want to ask one question. Do we have to have a separate entrance and exit for the students?
No.
No.
If it's not possible, you don't. If you can, if it's possible, great, but not. But like if they were using the bottom room, down, they could enter in that door down there. You know what I mean? And then you could just use for the top room. They could come in the front door, the main door. But no, there doesn't have to be a separate entry and exit point for them. No, if it's possible, great. But if not, it's not. You just then got maybe stagger entries or start one group at 9 o'clock or one group probably 9:30 and the other one 10. To be fair.
Yeah, or 11, or even half 11. And Shane, probably the most common piece of equipment that is used in any office is the photocopier.
Yes, good question. I didn't mention it's good question. So, you don't use a flatbed if you can, because the flatbed is very hard to clean with the sanitizing equipment. So use the feed if you can. Yeah, use the feeder and then just wipe down the section of the top section of that, and then just wipes for the control where it's 1, 2, 3, 4, whatever. You can get a plastic covering. I don't know if anyone's seen them. But they've been used on some of the MasterCards and all that kind of stuff. But it's a lot of extra controls, a lot of extra cost. Just a simple wipe can clean it for you.